have my tape, I have a pen that I'm going to mark with. And, all right. Some facilities, they use red bag. Kennedy does not use red bag. I haven't seen, so it would go in regular trash. So does Underwood. They don't have red bag. The video practice with red bag because it's body substance. I'm going to practice with red bag. And you guys can too. That way you save your dressings and you can pack them back up. Okay, if you go in there, it's a little more difficult. Okay, and gloves. I already communicated, I checked my order, I washed my hands, and I have my clean gloves. All right, so privacy. You're going to need 2 pairs of gloves. Put on my gloves. First thing we're going to do is remove the old dressing. And I do want to see when you remove it, you're holding down. I'm telling you, these nurses, they just tear that skin off. My dad just tearing it. You want to kind of follow the hair, not rip across the hair. It's very painful. So really take your time out there. Hold and pull, hold and pull. You just rip it, you're going to rip skin off. Now instead of a small one, you have an incision of this rectangle. And I want to see you doing the hold and take off. You remove it. I have a Penrose drain and I have 1, 2, 3, 4, 5, 6 staples. I'm also assessing the wound as well as the dressing. And right now I don't have any, but usually it's yellow, could be serous, sanguineous, dime size, quarter size. I hate the term small, moderate, large. It's you, just saying that, you can picture a dime, a quarter, a $half, or, better yet, 10 centimeters of dressing, which is harder, but we will do it with that, but not for testing. Right now, I'm just showing you what you're going to do for testing. So remove it. I'm assessing, and you saw me count. You saw me say Penrose. Slight redness around the staples, but well approximated means it's healing. There's no opening. No dressing, no drainage on my dressing. Fold it to contain it. Take your glove off to contain it, dirty to dirty. Try and get your gloves in there. I guess I'm not going to be able to save this anyway, so I'm just going to go right in the trash. And then right in the trash. Either red bag, if that's your facility's policy, or regular trash. Okay, now I'm going to get my equipment ready. I guess I should use paper since she had paper on. I usually put what was on is how I'll do that. So I took off 2 4x4s and an ABD and paper tape. First thing, because I always forget, initial, date, and time. Because I don't want to write it on them, so I do that. Okay. Open sterilely. 4x4, 1 to clean.
So the 4x4s are sterile as well?
All of them are sterile.
Okay.
I'm not sterile, but my dressings are sterile. That's called a clean, simple wound. Sometimes, and on the video, they actually had the sterile field, and she was sterile. That's a more complicated dressing. This is called a clean, simple. So I have 1 to clean, sterile opening, which obviously, 1 to dry, 1 to put on the wound, and my ABD dressing. I need my saline. Hold the label in your hand. Lip it to clean the top. That goes upside down. And this one looks wet, so I'm going to wet it. I wet 1 to clean. Hold up and let it drip on. You can see I'm not reaching over. I'm kind of going sideways. All right, now I'm set to do my cleaning. and my, remember I changed, I would have had this in the beginning, I'm not using that because I'm not going to be able to save it anyway. Put on my clean gloves. Alright, so my dominant hand I'm going to be cleaning with. So I'm going to grab, I'm going to keep my non-dominant as my sterile. Darn, there's only one in here, I wanted two. No, I'm going to have to only clean up one then. So pick up, I'm going to clean. Usually you have two. This is an up-down, so it's one swipe down, toss, and that tossed in there. My clean hand, I pick up my clean one, transfer to dirty, top to bottom, wipe down, toss. My clean one, take a dry one, transfer it, dry, toss, clean hand, transfer, dry, clean hand, dress it. I only really need one. The blue is the outside because then we can see if it changes color, it's wet. Don't touch the inside. Cover. I usually take one because it's covered. I know I'm not going to get any drainage on. You want the, and they talked about it in Vav, a little over the dressing, extend it. Pressure tape. So kind of start in the center and push outward. We extend it because if it really is draining and they turn, it will leak if it's not pressure tape. So that drainage will leak right on the bed. And that's why you extend it and do pressure tape. Just kind of in the center and press and hold firmly. I think this looks easy for me. It's not easy. Just like the sterile gloves didn't look too bad till you did it. This is the same kind of skill. See how I take this, pull it tight, and pressure. In the real world, with the pubic hair, I probably wouldn't be taping this. Now I have to decide, is it better to tape the pubic hair or is it better for drainage? Well, he's draining a lot, I want to tape it. It's scant drainage, I'm not going to tape the hair. See how? So I can't tell you, yes, you have to tape all the time. It's patient specific. I do want to see you press and that pressure tape.
You start from the center and then you
press down as you go.
Okay.
And on the two sides, then that third side, you kind of put the tape and pull the dressing so it's straight and not wrinkled. And I already date and timed it. Now I have to document. Part of your documentation documents observations correctly. I'm going to leave you guys to work on that. Because I could say it and then you're going to just copy what I said. So what has to go in the documentation?
Color, odor,
Good. What else?
size.
Good. What else?
Yeah, you want to just keep going, Jen?
And that's kind of color, odor, size.
You counted the staples. Do you need that?
Okay, yep, number of staples.
Kind of drainage.
Drainage we talked about. How did the patient tolerate it? Because that's going to tell me a lot about my next dressing. Right? All right, now that's how you do that. That's your testing. Now I'm going to show you how to measure wounds. So can I just, Morgan, can you just hand me that, please? So when you measure wounds, what you normally need is a sterile cotton swab to measure the depth. And then these are always good because you have the ruler 4 centimeters. And I have circle. Now for him, he's straight up and down. I only need the ruler. But for a lot of the cubes or pressure ulcers, you need the circle one. That's really all I need for this one. Oh, and there's cultures. Sometimes we have to take cultures of wounds. All right, so I'm going to take my gloves, clean gloves. I washed my hands already. Take my dressing off. Always with the holding the skin down as you take it off. Take the dressing up.
Look at how beautiful that
Observe
looks.
this. Observe this. Fold. Contain. Trash.
Man, wasted
Open my
supplies
equipment.
like it's water today.
I
Wasted
know.
supplies like it's water.
That's why I said grab red bags when you guys practice to collect your supplies. Open this. I want to keep
Oops.
yeah.
So
They're
much
usually
for that.
they're not like in this package usually. We can just keep it like that because that package was a little more difficult. Then I have this. I would then open my dressing just like I did because I'm going to redress him. Not right now. I'm just going to show you the measurement.
We're gonna be measuring wounds for our skills assessment. or
No,
no?
what I
Okay.
just did is what you're measuring
Okay.
now. I'm just teaching how
Okay,
you
just
would
making sure.
measure. You do
Okay.
have to measure the wound every time you do a dressing change, but not for testing.
Okay. That's all I care
So,
about.
okay, so I know that's why I did it first, and then I'm just
No,
showing
Morgan,
you
you care
how to
about the
measure
patient.
wounds. Obviously, you would have gloves on.
Very patient, you know.
And did
whichever
you say
comes
we're gonna have
first.
to bring our own equipment?
You do, you need gloves, you need all your dressings. This one's not open. So Jesse, can you give me that mannequin on the second shelf there? This one?
Ooh.
And what do you think that wound, how that happened? What's that term? Dehiscence, that's right, it
Dehiscence.
opened up. And we definitely want to check for depth of that.
Indeed.
So you definitely want sterile swabs going in there, don't touch that. And I actually would need 3 because I'm going to do the upper part, come down, pinch kind of where the skin is, come over, and you're going to measure on this, which is about 2 millimeters in depth.
Why don't they just put measuring lines on the sticks themselves?
There'd probably be more money. And this is used and then
That's
tossed.
true.
It's so the truth. They don't even have vests.
Middle,
Medication cards.
that's same thing. And that's 4 centimeters. And then the end of it, also, I always check for tunneling with my sterile swab. Sometimes you can't see it. Once you see it, and Evolve did a good job, they did the clock for the tunneling to document so everyone else would know. Then I take this and I measure how long.
Is it practically impossible to do this without paying for the patient?
Yeah, that's why Evolve did a good job with
Pre-medicated.
pre-medicating.
'Cause,
14
someone was sticking something in my
centimeters
wound.
long.
Kind of ticked.
Upper part is 1.5, middle is 2.6, and it's 1.5. And these are all measured in centimeters. And then I'm going to toss that. Then I would change and dress like I just showed you.
Would you need to, yeah, I was gonna say, when would you record all your measurements?
Yeah, how would you document that?
Yeah, you know
memorize
what? Because you're right, a new student it's hard. You do get better with memorizing numbers with experience. Your instructor's always with you. And when you're a new nurse, a lot of times you ask other nurses to come in with you. And then you will, I promise, you do get better with remembering numbers.
I was just trying to remember them myself. I was like, I don't
Yeah.
even remember what her
Yeah,
like. Their
I-
just
you know
failed my
what, because
cognitive
you're
test.
used to that measurement and doing that just as like everyday practice. You just like vital signs, I bet you're not writing as many, you're remembering all 4 of them and then documenting. Before it was like heart rate, respiratory rate, now you're not. Most of you are doing all and then documenting, right? So you do get better. I'm gonna keep this open for you guys to practice. You're not doing that part. You're just doing the removal, change your gloves, open, new gloves on, and dress. Yes. And I will be watching that your gloves come off the right way.
Why do wounds get filled with like sponge and then covered over?
Well, definitely this one would, because it helps absorb the dressing. So we would have the gauze Evolve that did a good job really packing it it absorbs all that drainage,
That
so
one
it's
was
not
gross.
sitting in there, and that's when
Does it heal
infection.
from
I
the
think it's the
bottom
lighting,
up so
too.
that
Yeah,
They have,
this
like, really
heals
good
from the
lighting in the
inside
lighting.
out.